Zang Fu, The Organ Systems of Traditional Chinese Medicine. Chapter 4, Origins of Disease. Internal factors. These refer specifically to Qi Qing, the 7 emotions: joy, anger, pensiveness, sorrow, fear, fright, and grief. Emotional imbalance affects the harmonious function of the Zang Fu, the formation of the substances, and their transportation through the Jing law to all parts of the body. The 7 emotions, the 5 feelings, and their relationships to the 5 Zang and to the origins of disease are discussed in greater detail in Chapter 15. Miscellaneous Factors. Bu Ne Wai In. The disease factors that are neither internal nor external, otherwise known as the miscellaneous disease factors, include nutrition, occupation, overwork, exercise, relationships, sex, trauma, and parasites. All these categories include aspects of both body and environment. For example, trauma and parasites may involve factors from the external environment, but may arise from internal disharmony resulting in careless behavior. Constitution. The constitution may be defined as the general level of health and strength of the body at any given time. The constitution results from the continuous interaction between the inherited genetic makeup of the individual and the environment. Dr. Shen divides life into 3 parts: life before birth, childhood, and adult life. Life before birth. This period of life can be influenced by various factors. Number 1. The state of the Jing of the parents prior to conception. Number 2. The state of the mother during pregnancy. Number 3. Events during birth. Disease may originate in one or more of these 3 main areas. The gene of one or both parents may be deficient, so that the sperm and or ovum are weakened. The mother may be ill, malnourished, emotionally disturbed, or taking drugs during pregnancy, and the birth may be abnormal, difficult, and prolonged. Hence, the baby may be born with illness or the predisposition to illness. This predisposition may be to general weakness, to particular types of emotional or mental imbalance, or to diseases of a particular Zang Fu or of particular areas of the body. Childhood. The subconscious mind of an infant is an almost clean slate and is extremely impressionable to negative as well as to positive influences. Childhood is a time when negative experiences can etch themselves into the subconscious more deeply than in later life. Also, this is a time of greatest physical growth and development, when certain pressures on the physical body can have a great and lasting effect. For example, malnutrition, trauma, and excess sex. Adult life. Although less impressionable than childhood, adult life is longer, and the adult less resilient than the child to shocks and illness. Problems must be dealt with as they arise, or they will both weaken the body and embed themselves into it. Generally, if the constitution has been poor since birth, or if the specific diseases has been present since that time, the prognosis is poor. If the problem is only recent, or has only occurred during adult life, the prognosis is more favorable. There are, however, make cases of individuals who have had difficult births and sickly childhoods, but who have later overcome these difficulties and had strong and healthy adult lives. Nutrition. Nutritional problems arise in three main categories. Number 1. Malnutrition. Deficient intake of basic requirements due to poverty, ignorance or folly, or impaired digestion, absorption and metabolism. Number 2. Excess. Excessive intake of food in general, or of certain food in particular, especially of those foods which are particularly harmful in excess. Number 3. Unwise eating habits. Eating at irregular intervals, oscillation from extremes of feasting to extreme of fasting, eating with hurried or emotionally upset, etc. The effects of nutritional imbalance are generally either yin, associated with cold and often with deficiency, or yang, associated with heat and often with excess. Yin effects. Insufficiency of food and drink may lead to deficient Qi, and to deficient Qi, deficient Shui, and deficient postnatal Jing. Excessive intake of cold or raw food and drink may lead to deficient Pi Yang, retention of fluids and Wei due to cold, and invasion of Pi by cold and damp. Yang effects. Overeating or excessive intake of rich, greasy, fatty foods, sugary foods, contaminated foods, or alcohol may lead to retention of food in Wei, blazing Wei fire, accumulation of damp heat in Pi, damp heat invading Da Chang, damp heat in Gan and Dan, and blazing campfire. Occupation. Occupational problems arise in two main categories. Number 1. Physical. Many occupations have their characteristic hazards to health. For example, the prolonged slouched seated posture of cleric workers, the wear and tear on the joints of neck and shoulders and back of farm laborers, the leg circulatory problems of those who stand for long periods of time with little movement, the oral problems of those working in conditions of extreme noise. Problems arising in this area include structural damage to organs and tissues, and local or general retardation of the movement of Qi and Shui in the Jin Luo. Number 2. Mental and emotional. The majority of individuals suffer, to a greater or lesser degree, from dissatisfaction with their occupation, from boredom, apathy, frustration, depression, or general stress. Retirement and loss or lack of job can give rise to similar emotions. The different types of emotional disharmony are discussed in Chapter 15. Overwork. Overwork may result from one or more of the following: insecurity, greed, peer group pressure, perfectionism, ambition, whether for money, power or fame, or desire to further a political, religious, or charitable cause, and so on. Also, a particular loss or a generally unhappy life may result in individuals immersing themselves in work as others immerse themselves in alcohol. Work is basically activity, and therefore excessive work will tend to deplete yang. Work tends to injure Shen Qi and also Shen Yang, and hence Pi Yang. Too much mental work and study are said to injure Pi. Also, the strength of too much exertion may damage Xin Yang. If work is associated with mental and emotional stress, this may deplete Yin, was deficient in of Shen, Gan and Xin, and perhaps blazing fire in Gan and Xin. This is especially likely in persons already tending to deficient yin. Exercise. Exercise may be considered in three main categories. Number 1. Insufficient exercise. Most people, and certainly most patients in the West, take insufficient exercise, and this is a powerful contributing factor to disease. If circulation of qi and shui is sluggish, then the operation of all body systems will also be sluggish, resulting not only in diseases associated with stagnation of qi and shui, but also with those associated with qi and shui deficiency and with the entry of external factors due to deficiency of wei qi. Number 2. Excessive exercise. While a 1-mile jog might be scarcely enough for a lazy overweight 25-year-old with an undemanding job, it might be excessive for a 70-year-old with a heavy workload. Excessive exercise will have the same effect as too much physical work. It will weaken qi of shen and shin. Number 3. Incorrect exercise. As with nutrition, requirements of both type and the amount of exercise vary with the individual, and individual requirements change with time. Common sense and moderation are the key words here. A vigorous game of squash may be detrimental in the case of angina, just as parachuting is unwise for overweight patients with weak ankles. Less vigorous and drastic forms of exercise may be more appropriate here, such as swimming or hiking. Exercise that is unsuitable for a particular patient is likely to lead to strain and injury of organs and tissues, and to disturbance of the healthy circulation of qi and shui. Relationships. Diseases arising within the body in situations of difficult relationships with other individuals are often patterns associated with emotional disharmony. The various types of emotional imbalance are discussed in Chapter 15. Problems associated with close relationships may be especially difficult to help. This is due to the great amount of time that the individual has been and is exposed to close relations, and hence to the depth to which patterns of behavior are ingrained, and to the power of the emotional pressures behind them. Sex. Sex is a matter so closely interwoven with personal relationships as to be virtually inseparable from them. Hence, sexual problems are rarely of purely physical origin. For example, impotence, the inability to get or maintain an erection, is usually due to a combination of various emotional and mental factors. That is, anxiety, guilt, lack of confidence, and is often in terms of a particular relationship. Chinese texts generally regard excess sex as conducive to ill health. This is discussed on pages 71 to 72. With a population in excess of 1 billion, the Chinese do not emphasize problems arising from insufficient sex, although, as in any other area of health, both excess and deficiency may lead to difficulty, depending on the individual and the particular situation. Trauma, parasites, and pestilences. According to TCM, injury is accompanied by areas of local stagnation of qi and shui. Even after the local injury has healed and the local signs of injury have disappeared, a site of potential weakness often remains that may be activated at a later date. Later recurrence of a problem in the area may occur when the flow of qi and shui has been weakened by age, cold, malnutrition, exhaustion, or further injury. Obviously, an event such as the loss of a relative is a shock to the emotional system, and also a physical trauma such as the loss of a leg also carries with it a component of emotional shock. What is not so apparent is that mental or emotional factors may contribute to or cause perhaps the majority of physical accidents in the first place. So many car accidents, for example, are caused by tiredness, inattention, or the influence of alcohol or drugs. Tiredness may result from insomnia, so often due to emotional causes. Inattention may be caused by depression, anger, or the escapism of daydreaming. And consumption of alcohol and drugs result from emotional discontent. Trauma includes all accidents and injuries, whether they involve other human beings, animals, plants, or inanimate objects. Trauma includes, for example, burns, bites and stings. Parasite is a vague, general term that includes infections and infestations. However, there is the further concept of lead-chi or pestilences, which are considered as external disease factors, but as more or less distinct from the 6 climatic factors and as able to invade even a healthy individual. Treatment as a disease factor. Physical injury may follow incorrect acupuncture treatment or mistakes or difficulties during surgery. These injuries tend to lead to structural damage of the tissues and either to obstruction of qi and shui, accompanied by dull or severe local pain, or to signs of chronic inflammation and irritation with redness, soreness, and swelling. The former is often associated with local accumulation of cold and damp, and the latter with local accumulation of damp and heat. The use of inappropriate type of or dose of Western medicines may lead to illness. This also applies to herbal medicines, but to a lesser degree. Even correct use of a very large number of Western medicines may lead to illness through their side effects upon the body. This rarely occurs following correct use of herbal medicine. The incorrect use or the side effects of the correct use of Western medicines and treatments may result in deep and lasting disharmonies of the mind, the emotions, and the physical body. The signs of these drug-induced disharmonies are very common in the West and can greatly confuse the diagnosis. The practitioner must be aware of treatment as a common disease factor and must assess this possibility in every case. Secondary factors. There are certain secondary disease factors which may arise from the action of one or more of the primary disease factors which have been discussed above. 3 of these secondary factors are extremely important in Chinese medicine and are discussed in detail in later chapters. Disease factors are discussed at greater length in Chapter 17 in the section on patient education. Summary. In ancient China and third world countries today, or indeed in any poor and mainly rural society, the external factors of disease are predominant. Malnutrition and prolonged exposure to extremes of climate are major factors. In the richer countries with greater industrial development, the pattern of illness is different. The internal factors, especially emotional and mental stress and disharmony, are the main factors originating, aggravating, and perpetuating disease. However, human societies and the sex system of this planet are in a process of constant change and development. The rate of change is accelerating with the growth of communication system and of world population. In 50 years, The pattern of disease in all societies are likely to undergo great change, and the pattern of treatment must alter to match this.